Good good afternoon, everyone. I'm sorry for that. So let's now begin this today's webinar. So on behalf of the Asian Young Pharmacists Group, I would like to warmly welcome you all for today's webinar entitled Smart Health Tools Empowering Pharmacists and Patients for Safer Drug Use. So before anything else, allow me to formally introduce myself. I am Josephine Alexa H. Graza, a hospital pharmacist from the Philippines and currently serving as the External Affairs member of the Asian Young Pharmacist Group. It is my honor and privilege to serve as your moderator for today's webinar. So we are very glad that you could join us today as we explore how smart health tools can play a vital role in improving medication safety and empowering both healthcare and professionals and patients. So before we move on to our main program, let me share a little background about this collaboration. So today's webinar is not only an initiative of the Asian Young Pharmacists Group, but also made possible through our partnership with PharmCare. This collaboration reflects our shared vision to harness technology and smart health tools in order to empower both pharmacists and patients towards safer and more effective medication use. So, by working all together, AYPG and PharmCare aim to create more opportunities for learning innovation and impact in the practice of pharmacy. The Asian Young Pharmacist Group is proud to announce its new partnership with PharmCare, a Hong Kong-based digital platform dedicated to advancing pharmaceutical care and medication safety. This collaboration marks an important step in the AYPG's mission to strengthen the role of young pharmacists across Asia Pacific through innovation, technology, and cross-border collaboration. As part of this partnership, FarmCare will provide resources, expert insights, and sponsorships for AYPG's programs and events. In turn, AYPG will collaborate on event execution, outreach, and recognize FarmCare as a valued partner and co-host in joint events. Rooted in shared values and a common mission, this partnership aspires to foster innovation and create lasting impact among the next generations of pharmacists. Today's webinar is proudly brought to you by the Asian Young Pharmacist Group in collaboration with FarmCare. So now you might be wondering what exactly is FarmCare all about. So later on, you will know what's more behind this ultimate AI-powered medication management app. So together, we hope that this webinar will not only spark meaningful discussion, but also inspire practical application in your own practice. So we are all really excited now that you all are here as we learn and share ideas on how technology and smart tools can help us, whether as healthcare professionals or as patients, as we make drug use safer and more effective. So now let us now proceed to a quick run through for a few ground rules so we can all have a smooth session today. And I hope everyone will cooperate with us on this. So let me read the first one. Once you enter the room, your screen sharing, audio, and video will be automatically switched off. To all attendees, we humbly request that you please state your full name so that we can better identify you. So as much as possible, please change your name accordingly. And also if you want to, just put a underscore or from where country you are from. So please use the chat box functionality to post any question you have during the session. A Q&A session will be held at the end of the session to address them. And of course, the last, please stay until the end of the webinar as we have follow-up survey to implement what we learned from today's webinar with a chance of free registration for AYPG Leadership Summit 2025 in Lombok in October 2025. So at this juncture, so before anything else, this is the agenda. So this is a quick timeline on how this webinar will go through. So at this time of juncture, let me let me introduce our president, the Asian Young Pharmacists Group current president, Ms. Angun P. Wardhani, to deliver a brief introduction about the AYPG and its initiatives. Ms. Angun, the floor is yours.
Hello, Alex.
Hello, Ms. Angun.
You can just call me Angun. Okay. Okay, thank you so much. Okay. I'm going to see the screen. Okay. Good afternoon, everyone. Warm greetings from Indonesia to all of you joining today's webinar. My name is Anggun, and I'm the current president of Asian Young Pharmacists Group, or AYPG. And I would say that it's a truly an honor to be here for our very first collaboration with the PharmCare. So, from our first collaboration, this is our first webinar, and I hope there will be a lot of webinar come along after this. So give me a time, maybe 1 or 2 minutes to introduce you about the AYPG. For those that never heard about the AYPG, so I'm going to give you a brief introduction about the AYPG. So AYPG is a non-governmental and independent organization representing young pharmacists from across the Asia Pacific region. And our mission is simple but yet powerful, is to empower young pharmacists and support them in becoming future leaders, both in their home countries or on the regional stage. So currently we are already officially registered in Taipei, Taiwan in 2022. And today, our vibrant network includes a member from Indonesia, Taiwan, Malaysia, the Philippines, Japan, South Korea, Singapore, Hong Kong, Cambodia, Thailand, Bangladesh, and recently Myanmar. Uh, Next slide, please. Okay, so our leadership team is structured to ensure inclusivity and collaboration, and is consisting of the executive committee. There's a president, president-elect, immediate past president, a secretary general, and chairperson for 4 different divisions. There's a project division, internal affairs, external affairs, and also public engagement. Next slide, please. And of course, there's also subcommittees member. This is our big, passionate team representing 6 member countries who also contribute for the daily activity to AYPG activity. Next slide, please. Okay, and this is some of our flagship programs. Include first is the AYPG Leadership Summit. This is held every 2 years as our main platform for idea exchange, leadership development, and collaboration. And we are excited to tell you that we're going to host the 7th AYPG Leadership Summit this October in Lombok, Indonesia. And we also have the AYPG business meeting and also AYPG Farm Travel. This AYPG Farm Travel is launched in 2018. This is offering young pharmacists a 1 week immersion in a pharmacy practice in different countries. And we also have a wide range of webinars, mentorship program, and networking nights, and the AYPG Award. All is designed to build skill, foster community, and create a global exposure. And I hope if you understand about the AYPG, you also interesting to join one of our program here. Next slide. Okay, so I told you about our big event in October. That's the AYPG Leadership Summit 2025. And we have another big news for you. Next slide. This will be 16 to 18 October. This is 3 days, Thursday, Friday, Saturday, with an additional tour package if you want to visit around of Lombok Island. Next slide. And sorry. And during this webinar, from our host country, IYPG, they give a special discount for all those attend for today webinar with a 10% off or group discount, buy 5 and get 1 free. If you put this code, you can help. You can you can take a screenshot of this video here. You can put the SILAC Summit 2025 when you register the link in bit.ly/registration AYPS25, and then you're going to immediately get a 10% off. Next slide, please. Okay, so of course, we have social media, Facebook, LinkedIn, and also Instagram. And I hope if you want to know more about the AYPG, you can follow our social media account. Next slide. And we also have a newsletter. You can also take a screenshot for this if you want to join our official newsletter. Okay. So before I close, on behalf of AYPG, I would like to express my heartfelt thanks to all attendees, speakers, moderators, and especially the committee members. Today's webinar is the result of the great teamwork, particularly from our project division, external affairs division, and public engagement division. And also special thanks to Yongso Kim, Dane, Alex, Daniel, Cherry, Frank, and also Alisa from PharmCare, who worked tirelessly behind the scene and to make this event happen. I hope today's discussion bring value to your professional journey and inspire you with a new perspective. Thank you once again for being part of this milestone collaboration and today's webinar between AYPG and PharmCare. Thank you so much. Return back to you, Alex.
Thank you very much for that, Angun, for that wonderful introduction to AYPG. So now we would like to invite everyone to stay connected with us. You can subscribe to our official newsletter by visiting our website at www.asianypg.org or simply by scanning the QR code on your screen. And of course, don't forget to follow us on Instagram, LinkedIn, and Facebook so you can stay updated with our future events, initiatives, and opportunities to engage with fellow young pharmacists across Asia. And if you stay with us until the very end of this session, you will get the chance to enjoy free registration for the upcoming AYPG Summit. So that's definitely a great perk that you would not miss. So make sure to be attentive until the end of the webinar. So yeah, before we jump into the main session, can I see some heart reacts from everyone? So that I will know that all of you are being attentive. So let's spread some love and energy in this room, guys. Thank you so much. Okay, so now let me introduce the guest speaker for this main program. Our guest speaker this afternoon holds a Bachelor of Engineering in Computer Science and a Master of Business Administration, both from the Hong Kong University of Science and Technology. He also served as a part-time lecturer in entrepreneurship at both the University of Hong Kong and the Hong Kong Polytechnic University. He is the founder and director of PharmCare and Team Care, and the co-founder of HK Good Post and Drug Icon CC. His expertise and dedication in integrating technology with pharmacy practice have paved the way for innovative solutions that support safer and smarter drug use. It is an honor to welcome our speaker for today's session, Mr. Albert O. Let us all give him a virtual round of applause, please.
Oh, thank you so much. Thank you, Alexa. Thank you, Akun, having us to share about farm care. And especially today, we would like to share about our project called Drug Icon. So I believe that both of us, or all of us, are really working very hard in the medication safety, especially for the community, for the elderly, for the carers. So the Picture Icon is also initiated like this. So a little bit my background of myself, which has been covered, but myself is more focused in health tech, which has been working in IBM before, in digital health for 30 years. So and now we are working on more in the farm care basis. So the solution we are introducing is also want to facilitate how to make the medication safety in the community. So here is a quick video, but it is in Chinese, but with English subtitles. So give you some insight on why we are having this drug icon project.
呢度有，呢度都有。喺日常生活裏面，身邊總會有唔同嘅標誌，幫助我哋容易啲理解周圍嘅事物。你又有冇諗過呢啲標誌可以加強我哋對藥物嘅理解呢？通過喺藥物標籤上面加上清晰易明嘅圖標，我哋希望能夠幫助到長者提高佢哋用藥嘅依從性。
平時大家假如攞開一啲藥物嘅標籤咧，全部都係字，亦都啲字都好細啦。對於老人家嚟講咧，咁佢哋攞嘅藥嘅數量咧，少至可能6、7種，多至成10幾種。同一時間要睇咁多細字嘅藥物標籤咧，係好有困難。所以我哋覺得就係對於啲老人家啦、照顧者嚟講，藥物圖標可以通過一啲圖示，令到佢更加有信心啦，同埋更容易咁樣咧去明白點樣用藥咯。
目前為止，我哋設計咗30個藥物圖標。除咗可以幫到長者唔使食藥估估下之外，藥物圖標同時亦都可以幫助到少數族裔社群，令到佢哋更加放心用藥。
To read the drug labels, it's very hard for my community. When patients go to the hospital or GOPC, they get some medicine. They cannot understand the English. Sometimes they even cannot read Urdu or Hindi language. We need to only write 1+1, something like that. For those kind of patients, these drug icons are very important and very helpful.
藥物圖標已經喺台灣同美國實施，嚟到香港，我哋以共享創意嘅形式推行，希望能夠廣泛應用喺本地診所、藥房，惠及更多嘅病人。喺我哋設立藥物圖標嘅時候咧，已經訂立咗咧 Creative Commons 呢個概念去做啦，就希望可以大家一齊去共創呢樣嘢，一齊為咗呢個藥物圖標一齊去工作。其實我哋都希望藥物圖標可以有個願景，就好似手機上面用嘅 emoji 咁樣，呢個共同嘅語言可以令到喺跨地域上面都可以利用得到。Okay, thank you to all of you. So this is a quick 2 minutes video to give you some understanding on what we are doing. So I know that some of you may be in Hong Kong, but some of you may not in Hong Kong. But these are the Hong Kong traffic sign. So by looking into this sign, given that you're not in Hong Kong, I think you may already have some understanding that some is represent that there is school nearby, there's some construction nearby. So this sign is quite universal and common, so that people, even that they don't have the comprehensive knowledge on the road safety, but they have this kind of signage to help them to understand. And of course, emoji, definitely why you show all this heart, laughing, smile. This is all representative of some of the meaning and behind on this. But when we look into the medication label in Hong Kong, and I think it is not only in Hong Kong and some other location as well, this is very wordy and sometimes it is difficult to understand, especially when we work with some translator helping us to translate the material. They mentioned to us for the Indonesians, some of the elderly, they even can't able to read, or even they have a very bad eyesight. So if we can have some pictograph which allow them to easily to remember some of the pictures, that may be helpful for them to understand. This is where we come from. So in Hong Kong, the elderly which age 73 take more than 8 medication per day. So which is by number of medication is more than 10. So it is difficult for them to manage all this medication for such a long time. So this is also another challenge is who are going to sort these medications. Most of them is saying that they will be the one who sort the medication by themselves or by their spouse. And most of them are the elderly. I mean, two old live together. So the spouse will also be quite old to do all the sorting for them. So they have a big challenge in taking all this medication and handling all this information. So you think that after uh, consultation, they all give a instruction for a medication intervention. But what if they are not taking the medication right, which is making the intervention is not really meet their requirement. So that we see that how to make these people understand the medication and do the sorting is important.
So this is not only in Hong Kong, even in Singapore, which is quite diversified uh, country, they're also having the challenge that the label is not inclusive. So you see that label is also very small, fine print. Sometimes the pharmacist will put some kind of draw some logo or draw some pictures on that to let the elderly know about this. And so this is some of the finding from the NUS, National University of Singapore, medical school, and they talk about the unreadability, unable to read from the Singaporean elderly. So we see that this is not a problem only for Hong Kong, but also even for such a diversified community like Singapore, they also have these challenges. So what we want to do is we reference the other location, like Singapore, Taiwan, they all have different type of medication pictogram available, like Taiwan. Every hospital they may come along with a big medication label with different kind of pictures to represent how to use the medication. But the difficulty is when I just put down two labels there, you see that all those kind of icons or those pictures are different. So there is no universal icon or picture so that people can well understand and adopt to. So that they even with the pictures, they may not be very understandable on all this instruction because they are not unique, they're not well represented. For the US, they have something, but they are also very simple. So what we do is we try to check on any good use of the medication label or medication icon in Hong Kong. We find that there's some of the good design in Hong Kong has been designed by the design school student before. But that really, from a design perspective, from a learning perspective, but not really put into the market, put into the operation use. So that's why our innovation is trying to bring all this together: the design innovation, the process innovation, and technology innovation together. So here is a quick snapshot. Is our innovation part is implementation. How we can bring the design into university or design into the operation to serve the patient, to bring to the pharmacist, and being a good tools for you to for the medication education. The other thing is we see the challenges on the confusion of the different kind of like icons because under of different kind of copyright. So we design our icon in a Creative Commons license, which means everyone are welcome to use. You don't need to worry about the copyright. Just simply use this icon. You can download it and then you can reproduce in the materials. Just only one thing is you don't change the logo, so such that we can keep the uniqueness of the icon. But for the reproduction, putting for the commercial use, or put into your education, or put into your surface use, that is all welcome for all this because we want to make this like the emoji. Everyone can know about this. So this one is not something new. We've been doing this since 2019, which is the time before the COVID. We have been running this such that we have more than 500 users being interviewed. Those are from the medical professional, like pharmacists, and also we talk with the elderly. We talk with different kind of people with different cultural background because we want to make sure the pictogram is cultural cultural awareness, which is not sensitive to any individual or any uh, any nations. So this is what we are doing in design. So we have design version 1, version 2, and now come to the version 3. And then by the version 3, we really deploy this into the market and to the pilot. And then we put 3,000 users to use our drug icon kit and see the assessment. So some of the interesting finding we have done is say this is the material we put up. We put up the pill box such that when the pharmacist teaching the patient to use the medication, they can really use the pill box, use the sticker on the left to let them know how to put the sticker on the medications, and then let them know how to sort all the medication in the pill box. Usually, the elderly will say that they will know how to use the medication, but by asking them to really put the material in the put the medication in the pill box, we just find that they really don't know what kind of medication, what is which medication they need to put into. So that the understanding on the medication or use the medication is totally has a gap between the patient and or they understand. So we have all this information, and you can all simply DIY by yourself. You can based on the go to QR code, you can download all this kind of sticker, and then as we mentioned, it is all Creative Commons. It has come with free, so you can reproduce it or reuse it. Or currently we only cover Chinese, English, Urdu. In another version, we also come with Nepalese, Hin, Indonesia Bahasa, and also Nepalese, such that we can support more Southeast Asian language. So the community partner we've been deploying are mostly the elderly center and elderly home, and also community pharmacy in Hong Kong. So the feedback is quite good. We roll out by doing this summer Zoom talk. We do the workshop directly with the elderly. We also run the workshop with the healthcare professional, so they know about this tools, helping them to do the education and do the learning for the patients. Just thinking that for this workshop, which is we are doing is for the multicultural medication education workshop. We mainly talk about free highs, medicines for the pregnancy, because in Hong Kong we have quite a number of uh, young young mother coming from Pakistan to Hong Kong to deliver. So after they deliver, what kind of vaccination or medication they need to take or not to take. So this is something which we understand their need, and then we also leveraging the pictogram to help them to better understand how to use the medication. And for the free highs, which mean the high blood pressure, high cholesterol, that kind of thing, which is they need to keep on take the long-term medication. So they need to better manage their medication adherence. So we use our medication pictogram to let them know what kind of medication they need to take before meal or after meal, or what kind of timing they need to take, so that can help them to maintain their health quality without the deterioration, without a proper intervention. So this is something which is we both using the medication pictogram, but also we integrate with our workshop to deliver the medication safety and right use of medication for the community. So all this, we will say that how can I use it? So along with the DIY drug icon you can download, you can also leveraging our online education kit. This kind of material are all free for download. So you can find the material, you can download it, and then you can make the changes accordingly. So this is mainly refer to say which medication icon represent that the when to take the medication. If it is 3 times a day, which mean what the free when is the free time, say morning, lunch, or afternoon, whatever. So this is something sometimes the patient or elderly they don't know, so we especially put up all this kind of material to allow this. And we also have know that some of the people they don't like to read, so we also have a YouTube for that. It's just very quick to play a simple video here.
Collecting so many medicines at clinics or pharmacy each time. And find it hard to understand drug labels? Drug icon can be the help. We are going to show you the design concepts of 30 drug icons. Dosing schedule. Morning. Midday. evening, at bedtime.
Okay, so this video that is also available on the YouTube, and it is also free, the license free. So when you need to educate your user, you no need to go through to them one by one. You can play the video to them, or you can send them the video, so that will be effectively for you to uh, to uh, to talk with them, to train them how to use it. And also, we have all this kind of material. Other than the one pager, we also have the script for you. Say, if you want to do a teaching for this material, if you want to set a workshop by yourself, after knowing about this drug icon kit, you can download our teaching material because we already provide you some teaching guide so that you can download this and then conduct your own workshop on the how to do the medication education. Just think about that. If you talk about the 30 medication icon, say this one is about the dosing schedule. The other one say talking about the how to storage it. By completing the understanding on all these 30 icons, it mostly cover most of the right use of the medication or how to have a better medication adherence. Just like the road safety, you know about the traffic sign, you have a basic road safety understanding. By understand all these 30 drug icon, you can have a relative good medication understanding on all this. So this is what we are doing and what we are wanting to doing. And we know that there's not many material for a pharmacist to facilitate you to teach the patient. And so we prepare all this for you to facilitate you to teach the patient without you reproducing your material by yourself. So other than that, we know that now getting more technology. Is there any technology that can help you to deliver this kind of medication information more effectively? So ourselves in Hong Kong, we developed two solutions. One, we have a full solution, but here I would like to show two. One is our SaaS platform, which is a dispensing solution. The other is an app. So the solution, the SaaS solution, is a dispensing system in Hong Kong. Last year, we been processing about 70,000 prescription on it. Our amount is about 50 patient record is on our system, which is in Hong Kong is only 15 clients right now, but we are growing on this. So this dispensing solution is helping the pharmacists. They no need to stick the label on the label sticker on the label. So they just print it out and then label will come along. Say if you put it is after meal or before meal, then the before meal logo will show on the label. Or you need to take a full course, then it is complete a full course icon will be shown on the label. So that can help the patient to understand all this icon together so that next time when they read all this label, they can easily to reference this label more effectively. So you can see this is the sum of the sample. So you can see all this label come with the chart icon so that they can easily to refer to. And also, we know that some of the client, not all the client will using our medication dispensing system. So we will have our app, and you can also download the app right now. It is a PharmCare. I think you can download in Indonesia, Thailand, the most of the location. So you can download it. So what it is doing is it take a picture. It's really using the AI. It's take a picture, and then it will generate the medication into our label. Currently, we only take the medication in English and Chinese only. Sorry about that, but we can translate into Urdu, Nepalese, Indonesian, Bahasa, different kind of Southeast Asian language right now, around 7 language right now. So this is what the tools we are helping for those areas who are not using our farm care SaaS platform, but they also want to leverage this to helping their patient to generate this kind of medication label. So all in all, what we are doing in our transformation journey, so our farm care like what we are doing in 2020, we designed the drug icon. We also design our dispensing system. We design our drug icon kit so that the pharmacists they can use the kit to dispense the medication and using the kit to
educate the patient how to use the medication. And also we run the workshop so that this workshop, they are not only tell them how to use the medication, but also they will be based on their nationality, based on their religion, say that for the Nepalese, for the Pakistan, how they can navigate the use of medication in Hong Kong, that kind of thing, which is really thoughtful about that. And also we are having our SaaS platform 3.0 right now, and now also working on the care bot system, which is the chatbot system specifically for the pharmacy to use. Because in Hong Kong, a lot of the patient, they will use the WhatsApp to ask a lot of questions to the pharmacist, but the pharmacist may not able to answer timely or anytime. So we have a chatbot try to answer most of the question. They want to know about the medication usage, especially for those non-clinical questions. So all in all, what the logic model we are doing for the drug icon. By doing this R&D drug icon design, working on the education and training workshop, 300 set of education kits, set up the creative common. What we see is two things. One is the patient, they got a very good cognitive change. Before that, they don't have this awareness on the use of medication. But by doing this with their knowledge gain, they have more confidence that they can self-empower themselves. Such as when they ask them before, they will say some of the instruction uncertainty, but now they can say that, oh, I know this icon is represent blah, 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 and then they will know that this is how to use the medication. So this give them a very good cognitive change and knowledge gain. So helping them to self-empower themselves. This is not only for the patient themselves, the medicine user, but also the carer, because the carer sometimes will helping these elderly to sort the medication, but they may not take the medication all of the time. So they do worry about they put the medication wrongly. So by doing this, the carer, they also have a better knowledge on this, and then they can help them to uh, uh, better understand how to serve the elderly in Hong Kong. So this is what we see that the changes, and also some of the behavioral change effect, such as the time when they read the left hand side, read the wording, and read the right hand side with the icon. They already have some idea. Oh, this is about breathing in. This is need to be shake, or this is need to be as needed. This kind of thing that when they read all this icon, uh, 2 times, 3 times, or 4 times, they already pick up all this icon, and they will be more effectively than just reading all the words uh, every time. That will be easy for both the carer, the pharmacist in delivering the medication educations. So the logic model finally we find is in the short term, we see that the knowledge gain, the accuracy of applying to the drug icon, but the most ultimate goal is all the user, they increase the confidence. So they know how to take the medication themselves, and they have because they need to take it in a long time. So they will have more confidence for the self-care, and also reduce the service time for each patient, because they know that they are doing right, and then they can minimize a lot of re-education on all this kind of thing. So other than this kind of qualitative feedback from our research and survey, we also get some direct feedback. Some of the user, especially the multicultural user in Hong Kong. In Hong Kong, the medication is all Chinese and English, and the pharmacists mostly speak in Chinese or English. So some of the multicultural user, they mention, oh, someone really understand their needs to put some cultural awareness medication instruction for them. And also some of the nurse, they try to teach the patient how to use the medication. The pharmacist teach, but there's no tools, no education tools for them to facilitate, to teach them. So now we give them a very comprehensive 30 icons as a guide or as a tool, so that they can follow through to teach the people, just like teach the kids about the uh, English letters. So by reading all this English letter, they know at least some kind of basic understanding of use of English, and then some of the good summary, so that they can take care of them by themselves. So this is both the qualitative feedback and quantitative feedback we get from. So the reason why we want to join with AYPG is we know that you are all the young pharmacists. You all want to empower your patients, make the medication more effective, and then you want to adopt more innovation. So for us, as we would like to join you to advocate this kind of uh, social innovation or design innovation or technology innovation in your workplace, such that they can empower for the patient education and operation efficiency. And also, since this is rolling out in Hong Kong, but if you find that that is very good for your country, good for your patient, good for your community, we look to join to advocate this with you, so that we all know about this, and that can someday work out as an emoji so that everyone can know about this. Even that you travel in Hong Kong, you already know this emoji and you know what kind of medication how to take. Last but not least is like and follow our social media, and then spread the thing that even these icons are all in Chinese, but hope you will know that, oh, this is about the morning, this is about two pills, this is about shake well, and this is all about complete the full course. So this is our social media link, the drug icon, which is you can download all the material we mentioned. For the PharmCare link, which you can download our app, you know our pharmacy system. In case you think that that will be a good solution for you or for your services, let us know. Finally, is my LinkedIn, so you can connect me and then talk with you. Because we love to share and co-create with everyone. So if you find that our material is good for co-creation with you and your community, we are happy to do so. So thank you so much for having us for this sharing, and we believe that by joining with all this young Asian pharmacists, we can definitely can empower the patient safety in medication use. Back to you, Alexa.
Thank you so much, Mr. Albert, for that insightful and very inspiring presentation. We truly appreciate the knowledge you've shared with us. So from the today's session, one of the most important takeaways that we learned about the farm care is how they emphasizes the use of pictograms, right? So this simple visual instructions are especially valuable for the elderly or any other patients who may find finding writing written directions difficult to follow on their medications, right? So by turning complex medication instruction into clear and easy to understand symbols, farm care helps ensure better adherence, improve safety, and empowers patients to take their medicines properly and confidently. So it also highlights the importance of innovation and smart health tools in pharmacy practice and patient care. So, these advancements not only help reduce medication errors, but also bridges gaps in health literacy, empower patients to manage their own treatment. Most especially, we've seen in Mr. Albert presentation that most of the people just rely to themselves with their medications and such that. So that farm care app and these pictograms really help a lot so that they can take medication on time, they can take their medicines the right way or um the right the right dosage and the right medication itself, because we all know that there are certain medications that have the same structure or like the same how the like tablet or same size, color, and etc. So that with this app, it is also manageable, and we can help these people to adhere with their medications properly. So by embracing this technology, we are not only improving outcomes for individuals, but also strengthening our healthcare system as a whole. So as a young pharmacist, and here in across the Asia Pacific, I hope we learned a lot from Mr. Albert. And we hope that in our own little ways or in our organization, in our community, we can adopt to to this new innovation in the pharmacy profession and practice. So that's all. So with all this, we will need now moving to our Q&A session. So for those who haven't yet please feel free to send in your questions via the chat box. So we will be happy to raise them on your behalf. So a while ago, I saw some questions here already. So let me address it. Yeah. So here okay. So here are they. So for the first question, this idea of pictograms is very good. Are you planning to advocate for adoptions of this at the government or regulatory level, Sir Albert?
Yes, we are working in Hong Kong level. So for the solution, we are providing that why we are providing our medication pictogram together with the community uh, dispensing system is because by doing this, the most of the government medication will be dispensed in our community pharmacies. They will be using this, and then in this moment, they may not be a, regulatory level, but at least we check with the government that putting all this medication icon is appropriate. That they allow us to put it, and also there is also one from FIP. Definitely, thank you so much to point this out. We've been when we did when we start on the drug icon, we did a lot of research, especially the FIP one, um, and also even some of the drug icon we mentioned in Taiwan, in US. A couple of things which is we find that why we need to have a new set of drug icon. The number one is most of the drug icon, the current drug icon, are with copyright, so that if you want to use it you will need to apply or you need to pay for the copyright, which is we want to lower the barrier on doing this. For some of the icon like FIP1, they have been designed for more than 20, 30 years. So for those icons, when we look into and share with the user, their icon is more for the professional perspective. It's not for the patient perspective. So some of the icons say if you need to take the injection, there will be a lot of icon representative of different type of injection. So that will be quite complicated for the patient perspective, especially when you know that we want to make it simple and easy to read. So that's why we for the drug icon we keep it in a very simple with the six category, the route, the dosage, the schedule, that kind of thing. So that will keep it simple. The second thing is when FIP do it, it is not very cultural awareness because it developed in Western or developed in Europe side. So that is some of the representation or the understanding is not very close to Asian. So that's when we design this, we try to make it more cul less cultural sensitive, which is make it like general, like the emoji. So that is a modern design in the pictogram. And the third thing is that the design what we're doing is is less complicated. When you compare the design of FYP, they have a very complicated picture, but it is not easy to read. So for us, it is a very simple flat design, which is easy for the printer to print it. So from that perspective, that's why we are having our drug icon is not adopting FYP1. We only doing the 30 design. So the 30 design is what we see is the most common design. Well, we are also happy to work with you all to identify more icon we need to know, such as we are thinking about putting an icon for halal. Some of the medication which will be halal, that we don't have an icon for the halal medication. So that may be some of the icon we can put into, which is helping more people to be easy to take the medications. So I hope answer to Tani.
Okay. So there are still many questions here, Sir Albert.
Thank you.
Okay, allow me to read it for you. Okay, so Thus, the drug icons already have the data in reducing medication errors. A question from Asa.
Uh, we haven't do a clinical research on this, but we did a impact assessment on this. So what we did is we go through a third party impact assessment team to helping us to run this study, and we have find that the patient about the confidence level is higher. The answer they they're able to answer the medication uh, more correctly. So this is what we see. But if we need to further to do clinical trial, we definitely would love to do so.
Hey, so another question here is from Arin. Thank you for sharing the impressive application, Mr. Albert. I am curious, is there any alerts for contraindications or duplicate therapies?
Not this moment because currently for this contradiction or duplicated therapy, it may really require on the medication management review where you know about which that's why we require the pharmacist. You know that some of the active ingredient is the same, but the brand name is different. So this is something which we may not able to put into the medication label, but that will come with our system when they go through the medication management review, that they will come up. They will need another set of solution for this, but not drug icon can able to serve it. Drug icon is mainly to serve about the uh, accessibility of medication information, but not about I mean the duplication or that kind of thing. That is really require the professional to make the judgment on that. Say the polypharmacy, that kind of thing, which is the icon itself cannot do that. Yeah.
Okay, okay. So, with those questions, I think there are still a lot of questions here. They are really into the app to get more of it. So from Mr. Oh, first let me just read this from Mint, Noparat, Thailand. I admire your idea, your initiation method, development, and the outcome measure assessment. The idea can help patients who do not know the language on the medicine label because they do not understand the meaning or cannot see the small word on the medicine label. That's why it is very helpful. The pictograms are very helpful for everyone, especially those elderlies and other um race that can't understand the medicine label, and they can just, I think, sir, they can just translate into another language um that they can understand, right?
Yeah, we are open, such as Dominic mentioned. We open for more culture sensitive in the creation. Definitely, why we would like to have this co-creation with AYPG and different people is because we want to make it more accessible, especially for in Asia. We see a lot of people they have more medication in the intervention, but how to right use the medication is our job. So that we hope that we can join together to provide more tools, such helping them to do the right use of the medications.
So with this another question from Ronel from the Philippines.
Yeah.
So for the first one, let me read it. Wait. Would cultural differences possibly affect the interpretation of pictograms? Should other countries try to adopt this?
Oh, this is a very good question because when we try to do the design itself, we try to make it less cultural uh, dependence, such as when you say that before meal, after meals, such as just like and it's as simple as like this. So now we are currently it is adopting a bowl of rice, which is I think it is quite Chinese because not many people, not other people having the rice. But if we say that we put a fish over there, finish a fish or after fish. Some people say that I'm a vegetarian. I don't take fish, or some people pick other thing that will be Of course, that is not difficult. So we try to make something which is quite commonly understand, and then we try to adopt it. We can't say that uh, it can be that's why we also emphasize we still need some education on this, not solely the pictogram itself, but we try to make it as general as possible for every location, every religion, every country. This is one thing. But one of the icon, which is I mean, also need your help. Say when we design the pictogram for as needed, the PRN. So we don't know how to use a picture or icon to represent as needed. If we put a clock, it may be wrongly interpreted. So we currently now put a star, just let people remind that it is something special. But as needed is sometimes that even that people say that picture can represent thousands of words, but sometimes some picture cannot really represent some words. I can say that. So that is the difficulties of the pictogram. So I'm not saying that pictogram will be the only solution, but pictogram is a visual aid. It's a visual aid for you to educate the patient, the visual aid for people to learn. But definitely they need the your education, your advice, or other education to support them for that kind of medication intake.
Okay. So another question in connection with the previous question, were there any issues in pictogram design that have already confused patients? How were they addressed?
So for so far most of the icon we've been doing 500 interviews, and then we adopt this version 3. We of course we still have some minor feedback from other people. Then we will do two things. One is how we can enhance in the uh, in the uh, in the education material. The second thing that even that we know the icon is small, but we still put some wording at the bottom of the icon because it's still able to serve some of the meaning. So this is something which we try to mix with some picture and the keywords to let the icon can better serve the meaning or serve the usage. But we know that there may be a good usage, such as that's why we put up some YouTube, we put up some other online materials. So if they have question, they can go to our app and they can check, or they can go to our website to check out what is this icon too. Maybe later on they can take a picture, and then the uh, the uh, the ChatGPT they can tell them what is this meaning.
All right. So for the third and last question, in pursuit of the continuous innovation and improvement of the said application, how can patient feedback be incorporated continuously improve the pictograms?
Yes, when we do this, because now currently we have about 15 community pharmacies using our solution. So we on and off here get the feedback from the pharmacists. When they educate the user, they will collect from them. Some of the community nurse, they are using our medication pictogram to do the medication sorting to the patient. They also get the feedback from the nurse when they do the education. Is there any challenges, whatever? So that's why we work this collectively. So we also love to work with you all when you do this, and then you hear some any feedback, we can improve together and co-create together.
Yes, definitely. That's why feedback and consumers' feedback is also important since it is very critical so that you can improve more so that they can have more of the applications and they can utilize more of it. Yes. So for this question from Mint again, can you share the recommendation of using pictograms for some antiviral that require the exact time for the effectiveness, such as acyclovir, required to take it every 4 hours, around 5 times a day, and need to take it continuous till finished? Or the case of some medicine insulin inject before meal around 30 minutes. Is there the icon that show for 30 minutes before meal or not?
The good thing is that we have the icon for before meal and after meal. And usually when people know about before meal, after meal, they don't know what is the meaning of before meal and after meal. Maybe just 5 minutes before meal or 10 minutes before meal, but we know that that should be 1 hour or 30 minutes before the meal. That's mean before meal. So that's why we use this is as an education. It's not really icon itself, because people, I mean the patient, they know to understand the use of medication or the some of the the chemical mechanism on the medication. So that this is why we emphasize the education is important to the patient. So that this is only this medication before meal, but every times when they know about before meal, they know that it is not just have a meal and then have the food. So this is one thing we want to educate or empower the patient. The other thing is about the exact time, 4 hours, five times a day. So that thing is popular, and medication icon may not able to serve all this. So that's why we have an app as a reminder to together to as a digital medication reminder to remind the patient when to take the medication. The icon itself is just let them know you need to take it 3 times a day or 4 times a day. But the exact time, say, you wake up quite late, say 9 a.m. Then every 4 hours, then you need to count together. So that is something which we need to have another tools, because each people they may have different kind of habit of waking up and go to sleep. So the hour of taking the medication is quite varies by different people, such as the first dose of the day or the last dose of the days.
Okay. For the last question, I think you've already noticed this, Sir Albert, a while ago, but
Yeah.
let me reiterate it again. In the pursuit of being more culturally sensitive in the creation of drug icons based in the Asia region, are you open to adopting designs for some icons that may differ from one country to another? If so, will this be empirically driven and evidence-based in approach? Thank you, Mr. Albert, for the insightful discussion from Dominic from the Philippines.
Oh, thank you, Dominic. The reason we want adopt is the Creative Commons is we want to make this a collectively can make changes on this. So the thing is, we try to want to keep the icon the same, I mean the same version, the same thing. But if you find that there's some other icon, then we can upgrade the versioning, and then every location will use the same set of icon, because it's just like the emoji. If you change for a specific location, then that may have different interpretation again. So we are happy to work together and see what we can able to co-create together. But the thing is, it is in a Creative Commons license.
All right, you're still working, sir, for more. So you're still having to think more what you can
Yeah.
improve with regards to the different nationalities, different interpretation of other countries, so that this app would be utilized more universally and can be
Yeah.
understood in each country. So there.
That's why we love to work with you all, especially you are the frontline healthcare professional. You can hear more the voices the patient needs or the healthcare professional needs, and that is the input or the feedback for us for the improvement.
Yes, very much. All right. So are there any other questions before we close the Q&A session? So let's wait for a couple of 30 seconds to see if there are still people who are curious about any stuff about the app or how does it go. Okay. Going one, going twice. So are we all good? There are there still any questions? Closing the Q&A session in 5, 4, 3, 2, 1. All right. That ends our Q&A session. Thank you very much, guys, for all your questions, your curiosity about this application. And Sir Albert, thank you very much for your expertise on sharing your knowledge, your application to each and every one of us. So as we close today's session, on behalf of the Asian Young Pharmacist Group, I would like to sincerely thank Mr. Albert O for sharing his expertise with us. And of course, thank you to all our participants for your active engagement. And we hope that today's session has inspired you to explore smart health tools and leverage them in your own practice for safer drug use. So, before anything else, um, please answer or scan the QR code for the post webinar survey with chance to get a free registration ticket for AYPG Leadership Summit 2025. So, Miss Angun, how would we know who will be the winner for this raffle, or what do you call this?
I think we're going to send the email directly to the winner.
Okay. For about 1 week or how many days?
Uh, I think I will also discuss with our host country about it. Should be less than 1 month.
All right. So don't forget, guys, to scan the QR code and answer the post-sub webinar survey so that you would also have um the chance to win this perk and get your certificate, of course, for this webinar. So let us now proceed to our photo opportunity. So we may ask everyone to open their cameras. So now we could have picture together and we will post it in our social media platforms. Hello guys. Hello everyone. So who will be the one to take the picture? Should I? Wait. Who can take the camera? I mean, who can take picture, guys? Wait, let me
I
check.
will help. I will help.
Okay, Angun, thank you very much.
Let's wait. We have 66 people here.
Okay,
We're going to wait everyone to open their camera. Wait. Okay.
okay, are we all good?
Okay, I'm going to take the picture now.
Okay.
Smile. Because there's 3 pages, so keep smile for another 5 minutes, okay? Just keep smile, guys. We don't know where you are, right?
Keep smiling, guys.
Okay.
Okay,
I
are we
think
good?
we're good now.
All right, thank you guys so much for participating for today's webinar. And of course, thank you so much for your time and effort, Mr. Albert, for sharing your expertise and your knowledge to us. It is truly an inspiration for all of us to adapt or innovate something that we can help other people with our profession.
No, thank you, AYPG, and thank you all of you. Thank you so much.
Thank you very much, sir. See you soon again for another webinar. So
Bye-bye.
you
Thank
guys
you.
watch out for another webinar as well. Thank you all so much. Have a great day ahead, guys.